everyone, it's Sarah with RegisteredNurseRN.com, and in this video we're going to go over how to find veins in the hand. The hands are a popular place to draw blood or start an IV. And I'm going to give you some tips and tricks that I've learned over the years of being a nurse of how to get those veins to pop up and how to get the best IV access. So let's get started. Okay, in the healthcare profession, we like to use the hand veins. They're easy to go to. They're usually really superficial, not deep like your AC veins or your forearm veins. And they're typically easier to hit. But some things you want to watch out for, if this patient you're getting is going to be getting like Vesicant drugs, meaning these are drugs hard on the hands, like Phenergan, some antibiotics, amiodarone, you would never use a hand vein because these veins are fragile. You would want to use a large vein or the patient would need a central line. So make sure you see what all's ordered for your patient. Also, is your patient there for a possible pulmonary embolism? So they're probably going to be going for a CT with PE protocol, and you would have to get an 18 gauge in their AC. So you wouldn't even need to bother using the hands. And you need to ask yourself, is your patient going to be getting a lot of drugs, a lot of drips? Probably won't use the hand veins. Let's use bigger veins. But also ask the patient, a lot of patients do not like veins, IVs in their hand because it hurts and it is a sensitive area. So just warn the patient because there's a lot of nerves there. So what I like to do is I like to begin by putting the tourniquet on. Some people put the tourniquet above the elbow, but whenever I'm doing the hand, I put the tourniquet about right here in this area. So let's do that. And if you don't know how to properly put on a tourniquet, I have a video on how to put a tourniquet on properly because there's a way you want to do it. Okay, it's on. And what you're going to do is you're going to have the patient pump their hand because that's going to cause all this blood to pull into these veins and engorge them and make them really large, because you're going to decrease your chances of missing this vein if this vein is popping up at you. That's a lot of issues that new beginners have. They don't get that vein nicely and engorged. Okay, so you can quit pumping your hand and just look at how beautiful these veins are. They've just really popped up there. Now, if you have a patient who's dehydrated, you definitely want to get this done with the tourniquet on fairly tight, have them pump. If you have someone who has really cold hands, they have bad circulation, try to get a warm blanket and put that over their hands to make those veins come more to the surface, because in order to get the veins in the hand, you have to have them close to the skin. Now let's zoom in and look at these veins. Okay, these veins are nice and engorged. Another technique, if you're having problems getting these veins engorged, have the patient dangle their arm down by their side so all this blood just pulls down there. And another thing you can do to get these veins to really slap out or pop out at you is you can sort of slap them like this. I don't know if you've ever seen someone doing that, but it just causes them to really just bounce up and just become a little bit more visible. And this one popped up a little bit more. And it just allows you to be able to see it a little bit better. Okay, now what we want to do, I'm going to show you the importance on picking a right good vein in the hand. What you're going to look for whenever you are especially starting an IV, you want something that is straight. You don't want something that's curved or really small like this, because look, this is a 22 gauge IV. It doesn't have the needle. This is the cannula, and this part is what is going to go in the vein of the patient. So you want a nice vein that's straight, because if not, you're going to risk the chances of going through the vein, you're going to blow the vein or something like that. So what we'd want to pick for this is this vein is really nice looking right here. You would not want to use this vein right here. That is way too small. That's a great vein for drawing blood, but not a good vein for sticking a cannula in. See, it's not long enough. So you want to use this one or that one right there. Now, one thing that you have to watch out for, see where these two veins have branched out into one, it's bifurcated right there. There's a valve in there somewhere. And a lot of times whenever you're poking the IV with a needle, you'll hit it and you're not going to get blood return. It's like, oh no, am I not in the vein? But what's happened is that you've hit this valve and you're just not getting a blood return. So if you try to thread it in, flush it, you're probably going to see that it's in there, but just be aware of that. You probably hit a valve, and that's where those valves are, is whenever these little veins like to bifurcate. Now, after you do that, after you decide what type of vein you want to make sure that you don't have a rolling vein. Everyone's heard of the dreaded rolling veins, and your hands like to roll because they're so superficial. But after years of technique, I have learned how to prevent that. Okay, what you want to do is you just want to look and see how these veins roll. Move the skin around, look, touch on it. See how whenever I touch it, just with my finger, it like moves to the side? Yeah, that's called rolling. Now, if I went in with a needle right now with his hand relaxed like this, it's just gonna go to the side and I'm gonna miss it and I'm gonna get frustrated. So what you need to do to prevent that, have the patient make a fist, okay? And tell them not a tight fist, but a light fist, just like that. Because if they make too tight of a fist, it's gonna make these veins flat and you don't want that. So a light fist, and you're gonna poke the needle in, and and you can hold right here above it and just keep your veins stabilized. See, notice how whenever I'm touching with my finger, that vein is just staying in place and it's not rolling like how it was earlier. That is just an awesome way to prevent that from happening. So anytime you're doing this, hold it, have the patient make a fist and go straight in, and you're gonna get it every time. So that is how you find a vein in the hand. Hands are easy. Typically people have great veins in the hand. Just try to use these techniques that I showed you, and you should increase your success rate in getting an IV or drawing blood out of hand veins. Okay, that is how you find veins in the hand. I hope this helped you out. Be sure to check out my other videos on how to start an IV, the difference between different IV gauge needles, and things like that. And thank you so much for watching, and be sure to subscribe to my YouTube channel.